once you're logged in, or you stay logged in.
Well, I thought,
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
good morning, everyone. All right, you have an agenda in front of you. Any additions or changes?
No.
All in favor, please say aye.
Aye.
Any opposed? All right, you have the meeting minutes from September 3rd. What's your pleasure? All in favor, please say aye.
Aye.
Any opposed? All right, brings us to our first limited public comment. Good morning, Sarah. Okay, no one rushing for the public. And that brings us right to Sarah Laurie. You got too comfortable too quick. Good morning.
What a beautiful fall morning, too. And
Morning.
just seeing the colors starting to change on the way up. I do have just a couple of items. One is information on our peer recovery coaches, if anybody wants to have that. And then just our quick and easy card on accessing services and on crisis services. Making you move. Right. Well, I printed my notes on my home printer, and for some reason it came out super small, so I'm going to use my glasses. You all look fuzzy, but I can at least see my notes. But thank you for the opportunity to provide an update to you today. And I want to start by also saying thank you for your ongoing support, and especially for the support that you showed in passing the resolution to oppose MDHHS conflict-free assessment and planning plan. I think it was, thank you, I think it was quite successful across the state with so many resolutions counting from county commissions to create a pause. So the plan was to be implemented starting October 1st. MDHHS announced in about August that they were pausing that implementation and seeking additional technical assistance. So for now, the current waivers, Medicaid waivers that include the conflict-free language have been paused until January 1st. So the state has between now and January 1st to alter their plans. So we're really hoping that what they will come back with is something that is not as devastating to the public behavioral health system. But I will definitely keep you all informed on what's happening. Also, recently we held our community event at Potter Park Zoo, and thank you to Jeannie Pearl Wright for attending. It was great to see you there, and it was a very successful event. Over 1,000 community members, staff and their families, individuals that we serve came out for free to enjoy the day at the zoo, and it was really fun. I wanted to update you a little bit on the Certified Community Behavioral Health Clinic. Last time I was here, we were preparing for our annual onslaught of summer audits, which we passed through, but we were also last year in a recertification phase of the Certified Community Behavioral Health Clinic. I'm happy to say that we achieved a 2-year certification with no provisional, no plan of correction. So we're very, very happy that we are certified for another 2 years. And just to remind you, we are one of the 13 original CCBHC sites under the State Demonstration Project. This is a model that we embraced quite some time ago, so we were able over time to really put services and supports in place to be able to qualify to be in the project and to be able to become certified. There are now, last year, 17 sites were added, so there were 30 statewide. And this October, 3 more were added, with potentially 3 pending to be added in January, bringing it up to 36 certified community behavioral health clinic sites. That model has some rigorous requirements for staffing, governance, care coordination, integration of physical and behavioral health, technology, and a set of quality metrics that are required. The state's project, I've mentioned before, includes individuals with mild to moderate mental illness, regardless of their insurance. So we've spent the last couple of years really expanding our capacity to be able to provide services to not just the most severe individuals, but also to the mild to moderate. I think that has been very, very beneficial, especially to individuals who are on Medicaid, who have had trouble finding mild to moderate services in the community, because even though in the capital area there are many people who have private practice, the reimbursement rates are quite low in the Medicaid health plans, and so many people do not take Medicaid. And then in the past, we're unable to obtain our services because they weren't serious to severe enough. So it's been a good thing that has allowed us to better serve the community. It also has allowed us to serve people who are on commercial insurance plans, who also need maybe a little bit more than what they can find out in the community, and can access some of our services now as well. In 2024, we just ended that year, and we're gathering all of our utilization management demographics. So next time I see you, I should be able to share a lot more detail with you about the services provided to Eaton County residents in fiscal year '24. We know anecdotally that we have seen a continual increase in intake appointments, psychiatric hospitalizations, and in accessing autism services. And that mirrors state trends, and especially trends that we're seeing in our region. The prospective payment rate under the demonstration project for CCBHC has also been very beneficial to us during this re-enrollment period. So in fiscal year '24, when the public health emergency ended, everybody on Medicaid was going through a re-enrollment. And under that PPS1 rate, one of the things that makes it such a great model is that we get an enhanced payment under Medicaid. And what we don't spend from that enhanced payment, we are able to retain in a risk pool. And that becomes flexible dollars when at the next fiscal year. So we were able to build up a bit of a risk pool, and that's helped us keep people in service during this re-enrollment period as people have fallen off of Medicaid or have had lapses in periods of time on Medicaid. We've been able to keep people in treatment because of that. So that's beneficial. It's also really helped us as the spend downs were turned back on. So that means that people are back to paying huge amounts of personal income monthly before they can qualify for Medicaid. So many times we have to help supplement that to keep people in service. So there have been some challenges, and with the end of the public health emergency especially, we have seen in the public system across the state that the projections that the state had made on Medicaid enrollments were too high, and it's caused a deficit in the rates and being able to adequately cover the expenses of providing services, particularly as we have all seen increased enrollment or increased psychiatric hospitalization, autism services. So it was estimated that fiscal year '24 fell short by $93 million across the system. It left many CMHs and our PIHPs, the regional entities, in a deficit situation. MDHHS recently agreed to provide a 1% additional funding to the system. That resulted in about $41 million, but still far short from what was needed. In our region, Mid-State Health Network anticipates depleting its internal service fund by the end of fiscal year '26 if there's not relief. Meeting in the deficits in fiscal year '24 would not have required any new appropriations from the state. They had plenty of funding in the budget. They just simply did not appropriate all the funding they had in the budget because the rates were set too low based on the previous projections. We've been fortunate in our area, however, the combination of having that ability to build up a little bit of a risk pool, and I think because we have done a really great job across Clinton, Eaton, and Ingham counties, our DHHS, our health departments, us all have worked very hard on re-enrollment. And so I think we are in a better state because of that than other parts of the state. So our funding at CEI has continued to be stable. I can't say the same for our region, however, where many other CMHs are struggling. Other challenges include continuing to find community psychiatric placements. That continues to be difficult, but it is better. We are better able to make those placements. There are still some people who get caught in our emergency departments, too often awaiting psychiatric placements, or in our crisis services department. That still happens. It happens also in jails and in our youth centers. Still hard to find those placements, but a little bit better. A couple of changes this year, a little bit disappointing for fiscal year '25. Oh, I'm sorry.
That's okay. Okay, so let me catch up. The reason that you're having a little bit better psychiatric placements, is that because they added beds, like we just added onto the juvenile facility? So someplace in the state, they've been able to also expand bed space? Is that why?
I think it's what's more likely is people's staffing has improved. So a lot of times it hasn't necessarily been a shortage of beds in the psychiatric hospitals. It's been that they could not fully utilize the beds they had because they didn't have staffing capacity.
Okay, we ran into the same thing at the medical care facility over here, where they had 2 wards off, but now they're pretty much back up because they were able to secure the staffing. So
Yeah.
that would make sense.
Yeah.
Thanks.
Now, there is still a need for more youth beds, especially in our area. Yeah. Very limited. There are only 14 psychiatric hospitals for youth across the entire state. So if there's a wait, it's likely to be for youth.
How far would we have to send a youth that would come into the CMH system? How far away are they from their home base?
Yeah, the closest is St. John's, Cedar Creek. And then after that, we're sending to Grand Rapids, to Detroit area. Yeah,
Thank you.
sure. So for the past 8 years, we've also had staff embedded in the McLaren Emergency Department, 12 hours a day, 7 days a week. Unfortunately, due to the financial issues that McLaren has faced resulting from the breaches that they've dealt with, they recently notified us they'd be ending the contract for this service as of September 30th. So that's unfortunate. It's been a really good thing for our community to have our staff embedded in that emergency department. McLaren does not have their own behavioral health staff on site, so we were sad to see that end. We also had 5 staff positions reduced by Ingham County Health Centers as they also grapple with some of their financial shortfalls. Fortunately, yes?
Sarah, is that because they closed the one clinic and moved those patients over to Forest Community on Cedar?
That, in part, yes. And the arrangement we've had with Ingham County Health Centers is a combination of CMH staff embedded and Ingham County social work staff embedded, and then we provide the clinical supervision. So as any of us would do, you kind of start by looking at reducing your contractors before you reduce your own staff. So they've retained their staff and reduced ours, but we continue to have some staff and the clinical supervisor. But as you know, we have had a hard time filling all of our master's level positions anyhow, so we certainly had no problem finding other positions within the organization for the staff from McLaren as well as the staff from the Ingham County Health Centers. Both of those were very good, unique partnerships, and I know none of us wanted to see them end, but that is the reality that we're dealing with right now. State hospitals also remain out of reach for most situations. We're relying a lot on our specialized residential contracts and our direct run residential programs to try to serve people who may have otherwise been more appropriately served in the state hospitals. So they continue to have some construction going on and some staffing capacity issues. We continue our efforts to fill our master's level positions, expanding our social work internships, funding our own staff, cohort of 9 through the master's program. We also have 3 cohorts this fall of nursing students from MSU going through our programs, hoping to build a good, strong pipeline to working in the outpatient behavioral health system. We're also hosting a hiring fair this month at Jolly Road for our residential technician positions. And you're probably aware, have heard me talk about before, our efforts to open a crisis stabilization unit for the capital area. And we have been diligently working on that this year as a pilot project for MDHHS. We're one of 9 sites. We recently have seen a lot of progress in moving forward with the renovations of the Green Lawn Women's and Children's Building. Right now, it's out for public notice for the county bond through Ingham County. In the meantime, that should be wrapped up by the end of November, but in the meantime, we are hoping we can begin some pre-construction demolition on the site using the grant funds that we have. And tentatively, we have a groundbreaking set for November 14th, which we will be sharing an invitation to all of you for that. This center will allow us to hold individuals for up to 72 hours, begin treatment right away, hopefully reduce some of the boarding that's happening in emergency departments. We know that's not the best place for people in behavioral health crisis to be. This way we can begin treatment quickly, hopefully stabilize people, avoid a psychiatric hospitalization, maybe even avoid a stay in one of our county jails, and to be able to divert people from those situations. We're also looking to reposition the Recovery Center and Bridges Crisis Unit along with our crisis services to create a kind of one-stop crisis stabilization center.
So Sarah, that'll all be located over there on Green Lawn, right?
Yep. Yeah, we have the Women's and Children's Building on the east side of the campus. It's one of the newer buildings there, and the Radiation Oncology. But the Crisis Stabilization Center will be contained in that Women's and Children's Center. So right now, we're anticipating that we sometime next fall we'll be able to start to take hopefully take possession of the building and start moving our services in. In the meantime, we have some startup staffing grants that we will start hiring people probably this spring and summer and take some time to train them. These are new services, having this secure facility where we may potentially have to use restraints at times, where de-escalation is going to be really, really important, and creating that gentle, welcoming environment, a therapeutic environment is going to be vitally important. So we will have a nice amount of time to be able to really fully train those staff and prepare them because of the grants that we have. I do also have some Eaton County updates. So we thank you for continuing to fund the truancy intervention program, such an important program for the county, and we have the one mental health screening piece of that program, and so that is definitely continuing on, up and running. We also at Eaton County Counseling Center are now almost fully staffed, including in-person psychiatry. I believe we are also back at providing some psychiatry in the jail. We also have our Eaton County ICU, Eaton County Youth Outreach Unit, has been continuing. The funding is a bit uncertain, so we're maintaining what we're doing as we figure out what we might be able to continue to do. So that's occurring in the Delta Library. There's a BIGS group for older kids, a Littles group for younger kids, at Crosswalk Teen Space here in Charlotte, at Eaton Rapids Teen Space. We have some closed groups going on in the Eaton County Youth Facility, and my understanding that those groups are very well received by the youth and the staff at the facility. And the Little Vikings Child Development Center is another site for that. So these provide mental health skill-based groups, screening and navigation for youth and families, helping them to get into services if that seems to be needed. We're also working with the Barry Eaton District Health Department as part of their CDC Overdose Data to Action, or OD2A grant. It is supporting a full-time peer recovery coach dedicated specifically to serving Eaton County. And as we start a new fiscal year, we plan to continue our recruitment and retention efforts. We have a young workforce. I've been going around attending staff meetings across the organization, and it's just mind-boggling the difference pre-pandemic to where we are now. Our staff has turned over quite a bit, and we have a lot of younger, newer staff. So we are really focused on continued training and quality improvement and retention with our younger staff. We also will be full speed ahead, making progress on the development of the Crisis Stabilization Center, as I said, with the goal of opening in the first quarter of fiscal year 26. And as far as upcoming events, we have an elected and appointed officials meeting in person at our Jolly Road facility with lunch served at noon on Monday, October 28th. That is all I had this morning, unless there's any questions. Oh, I can see you now.
Questions for Sarah? Go ahead, Joe.
I don't have a question. She referenced in her report to us that there's the one program here in Eaton County that we haven't made a decision on in regards to their request for funding. CEI's fiscal year is from October 1st through September, similar to ours. They really kind of need to know what our intentions are. As she's indicated, that program is being received very well throughout the county, but also I note that are providing services to the youth facility. So I think it behooves us to say today, if at least where we are in this respect. I don't recall off the top of my head the exact amount that you're requesting. But I would, at this point, think that we ought to, if we can, make a decision today as to whether or not we're going to fund them so that they know what they're going to have available and whether or not they're in fact going to have to start reducing the services that the county youth are receiving here.
Any clarification on that as far as numbers, and does anybody want to discuss further?
Where has the funding come from in the past? It's not from our juvenile justice millage. It is from our juvenile justice? Yes. Okay.
Yeah, this, essentially it was, and I want to say it's for like $135,000 or what?
Honestly, I should have looked that up, but I didn't. I can grab my laptop and look it up if that would be.
But it's essentially a request for continuation funding that we've funded now for a number of years.
Is that but that's not the component that we do for our truancy program.
That truancy program is a separate program.
Yeah, we fund, so again, correct me if I'm wrong here, but we didn't fund anything. Then we found out from the truancy program that statutorily we were under obligation to do that. We made that amendment last month or month before. But we've not made any other further actions. Is that a fair summary? Okay.
Yeah, and there's at least one other request, I think, hanging around.
Oh, yeah, there were several, I understand, yeah.
155,000
Okay.
for 24, 25.
I've been right for 30-odd years and I was wrong for the first time.
So,
Getting old.
What's the name of that program?
It's ICU, but it's the
That's the
integrated.
program that people are meeting in libraries and local events for youth. That is sort of a get-together for interaction between youth and your group.
Yes, they do a skill-building curriculum on stress management and life skill type things.
The program we've already funded is the TIPS program.
Yep.
Found that one as being beneficial.
Not that this isn't beneficial, but what we found was that we were required to have the TIP program under the new guidelines through the state of Michigan's requirements.
Where are we at with, now we're opening up our youth facility and we're starting to hire. We're starting to have needs for some of this, some of the millage money. And I'm not sure where we're at on that, exactly where we are in terms of dollars that we're gonna need by the end of the year or next cycle.
So if you recall, when the budget was adopted, we eliminated the general fund contribution completely.
Yep.
And are relying on what was left over in the child care fund and also anything that was in the juvenile justice millage to get us through 24, 25.
Right.
And then depending on anything additional revenue in November, then other things would be considered at that point.
So the 155 we're talking about is part of that money that we
Held on to,
held on to so that we would have it for,
correct.
and we used it in our budget, so we've already used it.
We've,
We budgeted it.
yes, we've held it aside for that purpose, right?
Well, to me, that means that the money isn't really there to use. We've already budgeted it for our other programs. right?
Well, you have, but I mean, again, I'm not gonna say that it's like set aside into a fund. It's in that fund that we said we're using.
Yep.
So obviously, if our expenses exceed what our revenues from the state are, we're gonna need that money.
Yeah, we haven't
For 24,
designated
25, correct.
anything, but it's in the set aside for that group, for that money,
Correct.
budgeted for that. And this is a different action. We'd have to take it out of that
Correct.
budgeted, we have to make an amendment essentially.
Yeah, and I would go back to what Sarah had mentioned before, that right now, we're trying to get things in order here. So rather than to spend any of that resource on something that's not an internal county program, I think would be difficult not knowing what's going to happen in November.
Give that information. I appreciate the need and that we've always done it in the past, but I think we've already set it aside for internal use. That's how I read it, and we've already done that at Ways and Means and at our budget, annual budget, so.
Well, I don't think that's been made very clear to, certainly to community mental health, and I don't think to anybody else particularly. I mean, I understand that we're all on pins and needles in regards to what's gonna happen in November. And whatever happens the first part of November is gonna change the landscape significantly, one way or the other. On the other hand, we've moved forward in a number of areas, which you could argue that we should have held back. This is a program that has been up and running now for several years. It has part of its program within the youth facility. We're putting a lot of effort into expanding the youth facility and those programs, and it just seems like this is one of those situations where we're going to basically spite ourselves, because the types of services that they offer, quite frankly, are necessary. And if you want to give the young people who are going to be entering into that youth facility and those programs the best possible chance of success, we're going to need the assistance and the help from community mental health. And so if you're saying to them today, we'll pass, okay, you can certainly make that decision, but do not think for one second that should the opportunity arise so it's more comfortable for us to go forward, that they'll be able to just turn the key and just go right back to square one, because that's simply not going to be the case. That's the reality.
Jeannie?
Okay, so at my house, when I have a crisis coming, I try to make it so that it's manageable. And so if I have a $10,000 project, sometimes I can get away with a couple thousand now to start it. Now, what happens if we take some of that money, Blake, and we move it to cover some expenses for November and December? Do we have that ability to do something like that?
You can, that would go to Ways and Means. Let's just make sure we understand that you would be referring this to Ways and Means for a budget consideration. So here, you want to say, we want to move this to Ways and Means for them to consider that. So that would be that discussion. Yes, there is that opportunity. Again, I'm going to just say right now that the amount of people on edge, internal employees right now on edge, waiting to know if their jobs are going to be here, come January or before that. It's pretty tricky right now to say that we're going to extend in another program where we had said a couple of years ago that we were only going to fund it for the 1 year and then funded it again.
Right, I forgot
So it is nothing against CMH. Obviously,
This was one
we
of the
know the
shelf-ready
value.
Pandemic money products are correct, right?
The
Right, I
original.
The ori-
forgot
so-
about,
Yeah, this isn't something we've been funding for 20 years.
I forgot.
And we kind of pulled some money, it was 2 years old, we kind of ran out, if I remember right, halfway through the year, and we gave a little additional funding to get it through the next cycle. So,
Yes, and it's been extremely, prevention money that's why the juvenile justice millage is so valuable to the community. It's very hard to find prevention
It is.
monies.
Oh, and the program undoubtedly, no one's saying it's not a success.
Yeah,
Just my big picture summary of what I recall, all people that put in for the juvenile justice millage funds were basically put on notice a year ago, not 2 days ago, a year ago, that our project was large scale and going up. And we were willing to fund everything for another year. Well, that year is now here. And we told everybody no. I will agree, Joe, it was not clear. I agree. I agree. Because I personally told everybody here that day, hey, it's no for now, and we will see what we can do. I know it's not conventional and it's not helpful for everybody's budgeting. I'm well aware. But unfortunately, the answer still remains the same. And I do understand what you just said as far as it's not going to be an easy flip of the switch. But big picture, this is not something that just popped up. So my understanding is everybody that was here has been informed in some fashion that it's not going to function for now, for this year, for this budget cycle. And yes, we are all in pins and needles. So yeah, it's an unfortunate situation, but the funds have already been budgeted. Now we can entertain any other thoughts, and I respect those thoughts because it is a worthy program, absolutely. But that's my understanding of where we're at. Any other further comments on that?
Well, it's hard for me to accept the idea that these programs were told that there was no. What I recall was that we basically said we didn't want to decide back when these programs first came to us, we would put them on hold. When the TIP programs were brought to us to be passed, there was a request to whether or not we wanted to look at the other programs at that time, and the decision again was to kick it down the road. I don't know that CEI or any of the other programs that came here looking for assistance with what we all seem to think are important and valuable programs could have inferred from that they needed to that they needed to know that there was no money coming from here. So it's unfortunate that maybe is now in everybody's mind makes it easier to say maybe actually meant no, and we just didn't want to say it out loud. But
Well, I think I said 2 years ago that these programs that were funded with COVID money were not going to be easy to continue. So again, I stand by the fact that this was not a fly-by-night, overnight decision. These comments were made years ago, and here we are dealing with it. So I agree, this is difficult. All of it's difficult. And I appreciate the advocacy for these programs. They need to happen. Someone's got to be fighting in those. At the end of the day, this is where the funds are. So I respect both sides of this issue.
well, I
Anything further?
appreciate the conversation about it. I know that you have a lot of tough decisions to make, and I completely respect that and continue to appreciate the support that you've shown in many, many ways. But I did know that it wasn't in the budget that was passed, but I just was confused as to whether you were making decisions on the child care fund, but holding the rest for the future. But it sounds clearer to me now that that's not going to happen.
Any other questions for Sarah? Well, thank you as always for taking time to come report to us. Appreciate it.
Thank you.
All right, that leads us to the medical examiner service agreement.
So we have had the same medical examiner since, I believe, 2002. It's been with Sparrow, now U of M. We received a notification. We had extended the contract last year for 1 year while they were trying to write some things in their house. I received this letter back in August Claudine and I have done some work on it. The increase that they're giving us, you can see here, is $380,000, up to $380,000, which will include having their medical examiner investigators, excuse me, that are on staff with them, versus right now they use them as contractors, which under the IRS rules, a contractor cannot be somebody who you're directing to do work. So they needed to make that change. In reviewing all of this, we have not gone out to bid for several years, obviously, so I think it's probably time that we should take this to a bid and seek other alternative examiners. Claudine and I have been doing some research looking at other counties, and I think we just want to go out for bid right now. We did not finalize an RFP at this point. We're very close to having one. I think Claudine's like, we're ready to pull the trigger on it, but we think that we should send that out and have something back to you in December to make a decision on.
I'll say that a couple of years ago, we were at the same dilemma, and we just, instead of doing an RFP, we actually did some research to who was out there that we could even hire. And it was very, very limited. You know, there just weren't very many options when it comes to one of this professional.
Yeah.
And so we hung in there and stayed with Sparrow. But I do appreciate the fact that, let's put the RFP out. We might end up, I don't know what we're gonna find, but again, a couple of years ago, it was pretty abysmal. We just wanted to change, but couldn't even find someone to interview. So
Yeah.
that's a heads up. We may not get much out of our RFP.
There is one more group that's out there now that's become more active, so there is another possibility. We're not going to be just looking at one, and
Our line item for this is what now? I don't recall it being 380,000.
it's,
I remember it going way up last time. It was for our own dedicated person, and now all of a sudden, for a
Well,
collective
yeah.
service, it's 380,000.
well, it was, so for 2024, this last September, I'm still in 2024, was 332,000. That was with ambulances.
Oh.
We increased the budget knowing that this contract expired at the end of this year. What we increased it to meets that 380, so we can cover that.
Okay.
And they did make some improvements. I've talked to them. They had a lot of issues with trying to get ambulances because, you know, you have ambulances that are serving specific needs where they're going to get more money for a run than they would get on a run to pick up a body. So they've had some times when they've had people waiting. I've had to actually get involved and tried to get somebody there. It's a very odd dynamic when it comes to dealing with a body that needs to be picked up. So they've done some work there, and you can see that includes part of the ambulance run. So again, done some work. I just think that now it's 2025, and we should look at this again since it was like 2002 when we went from, I believe it was Dr. Sains to Sparrow, Dr. Markey. And they've done a great job for us. That's
I'm glad
not a
to hear there
question.
might be some other options.
Yeah.
Competition is good, so.
Do you need a movement for the RFP, or?
Just for us to send an RFP out,
All right,
and I'll
so
let Sparrow know.
entertain a motion for RFP.
Motion that we send out RFPs to see what we can do about medical examiners.
All right. Any further discussion? All in favor, please say aye. Aye. Any opposed? All right, so we will go shop the market. All right, opioid settlement, oversight committee, overnight.
So the committee met with Amy Delinky and developed an RFP. That one is in your packets. On page 2 of the RFP, which is page 6 of your packet, at the very top are some key dates. So we plan to send the RFP out immediately after the meeting today, and then this will also come back for approval in December for any agencies that may apply for the opioid funding.
Questions on this?
think it's very well written with very specific goals that have to be met. So,
Would you like to move it then, since you love it?
oh, yeah, okay, I move the RFPs be sent out.
All right. Any further discussion? All in favor, please say aye.
Aye.
Any opposed? All right, very good. We got our RFPs. Committee appointments.
Yep, those are in your packet on page 14, the last page. So last time we gave you the committee list, it had all of the committees and the members on it. This list is just the committees that have expiring terms. So we are in the process of reaching out to those currently serving to see if they wish to be reappointed. I will note there is a vacancy on the Tri-County Aging Consortium Advisory Council. We do not have any applications for that yet, so if you know anybody, they have to be at least 60 years of age to serve on this committee. So if you would like to maybe throw that out there to some people that might fit that description and are willing to serve on that advisory council, that would be great because it is currently vacant. And then obviously the medical examiner will be going out for the RFP. And we're reaching out to Paula Jensen, who serves on the other two who are on the list.
Okay.
Claudine, who's resigning from the TCOA consortium?
Barbara Smith, was that maybe the name, Connie?
Generic enough, I think it works.
It's not Ruth Pearson, right?
I can look real quick. I just got to get there.
Ruth is Jane's friend?
No, Ruth is my neighbor. So I'll be over on her front porch if it's her.
I think Barbara Smith was the person, but that she's might be done.
Well, we didn't get the letter. Tri-County Office on Aging told us about it.
I did see that on something on our website, on TCOA, that there was an opening.
Yeah. Tri-County, so it's vacant.
Smith.
Oh,
Okay,
thanks, Connie.
thank you. So I don't have to go to my neighbor's house today, right?
You can if you want, but,
Oh, sure.
all right. So Barb Smith is the one coming off the board. Got it.
Yep.
All right, and we need to move this, or is this informational?
No, it's just informational.
Informational. Very good. Well, thank you. All right, brings us to miscellaneous. None? All right, very good. Limited public comment? No, she's shaking no. Okay. All right, we stand adjourned. Thank you for everyone for coming.